Good afternoon, everyone. For the past year, I've stood at press conferences warning about the dangers of COVID-19. Sadly, that risk is still very present in our society. But today, there are no additional COVID deaths to report, which is obviously very welcome news and another sign of the progress that we are making. As we look back over the trauma of the past 12 months, we think of all the losses that have been suffered. My deepest sympathies go to the loved ones of all those who have been bereaved during this pandemic. But let us resolve to never think of this last year in the terms of just cold statistics. It has been a story of human tragedy and loss, but we have witnessed a collective spirit that defied all the cynics. We united as a society to fight back against the virus and protect the most vulnerable members of our society. And also today, for the first time in many months, one of our local government areas has reported no new confirmed COVID cases in the past 24 hours. And this is a huge achievement, and I want to applaud and thank all the people of Fermanagh and Omagh Council area. But I also want to thank everyone across all the other areas for their sacrifices and their solidarity with fellow citizens. But the same spirit is still required. We must remain cautious and we must remain vigilant. The stay-at-home restrictions remain in place for now and will be in place over the Easter holiday weekend. The virus is still out there looking for ways to spread. So please keep following all the steps that will keep you and others safe. Spend the Easter period sensibly and respectfully. Remember that indoor mixing is still out of bounds for very good reasons. And while limited outdoor interactions are permitted, social distancing and common sense remain vital. My thanks to the vaccination programme. We are optimistic of better times ahead, more freedoms and more normality. We cannot jeopardise that better future by being reckless now. We have so much work to do, both in terms of combating the virus and repairing the great damage that it has caused. Rebuilding health services post-pandemic is a top priority of mine, particularly the need to address the backlog in operations and other treatments. The potential for a further surge in COVID-19 cases, however, represents the single biggest threat to that crucial rebuilding. That's a major reason why we still need to be cautious now. As I have stressed before, the best way to protect non-COVID care is to stop this virus spreading. The pandemic has highlighted serious fragilities in our health and social care system, especially in terms of its staffing capacity. It's no secret that our health and care system was already under immense pressure pre-COVID. 10 years of financial stringency had undoubtedly taken their toll. Northern Ireland is by no means unique in that regard. However, our system has been particularly fragile and strained for several years in comparison to neighbouring jurisdictions. Just look at our waiting time statistics. Resilience here has been seriously impacted by having a system that has been repeatedly documented as needing change. Successive reports over many years have sounded a bleak warning in that regard. Opportunities for investment and reform have been missed. Opportunities to build greater capacity and resilience are needed. The fragilities in our systems underline the particular need for caution in Northern Ireland as we emerge from lockdown. Our health and care services have had the toughest of years. They still need our protection now. We do that by doing all we can do to keep COVID infection rates down in the days, weeks and months ahead. I'll now hand over to Dr. Patricia Donnelly, the head of our vaccination programme.
Thank you, Minister. And I'm very pleased today to provide a further update on the rollout of Northern Ireland's vaccination programme. It's a real team effort, as you know, and it's a privilege to be part of it. We continue to pass landmarks on a regular basis. As the Minister has said, We're now approaching 700,000 individuals vaccinated, with nearly 800,000 doses given. We're at the moment completing our over 50s group and the clinically vulnerable, and we're very close to the point we will have reached half of the entire adult population in Northern Ireland. It's not that long since the historic day on the 8th of December when Nurse Joanna Sloan received Northern Ireland's first COVID-19 vaccination. A lot has happened since then, and we still have a lot to do. Next week we'll see more landmarks. The Vaccination Centre in the SSE Arena will open on Monday the 29th of March. Next week we'll also see the opening of over 300 local community pharmacies joining the vaccination programme. These are important developments. They will allow us to steadily increase capacity as the supplies permit. I can confirm we will be continuing to take additional bookings at the other 6 vaccination centres. Trusts have put special arrangements in place for the homeless, for the asylum seekers, and for GB residents currently staying in Northern Ireland. GPs are continuing to call priority patients for vaccination, both for their first and their second doses. As always, the vaccination programme can only move as fast as available supplies allow. As we've said before, we'd love to vaccinate everyone straight away, but that's just not possible. But we're getting there, and we'll get to you as quickly as possible. So today I want to make a direct appeal to the public to do all we can to help the vaccination programme run smoothly. The vast majority of people are doing this. The prevailing mood among those getting vaccinated is one of optimism and gratitude. However, there are some people who are not treating the programme and the vaccinators with the support and respect that they deserve. To them I say, please follow these simple steps to make this work for everyone. Firstly, be patient. If you're trying to book an appointment at one of the centres or waiting for your GP to contact you, please be patient. These appointments will become available. If you're waiting until you become eligible for the vaccine, please be patient and do not abuse the booking system. Don't book multiple appointments. Don't be a no-show. If you've booked, please turn up. Don't book at a centre if you've already confirmed a date with your GP. And please don't book if you're not eligible. If you do, you'll be turned away at the vaccination centre. There will always be frustrations in this process. This is uncharted territory for all of us. But supplies of the vaccine are continuing. They're steady. They're coming in as scheduled to increase in further weeks ahead. All we can do is to keep on doing the right thing for all of us. The target of reaching all adult age groups by the summer is firmly within our sights.
Okay, thanks, Patricia. And I hand over to Dr. Michael McBride, our Chief Medical Officer.
Thank you, Minister. Thank you, Patricia. As Minister said, thankfully today we are not reporting any deaths of people here in Northern Ireland from COVID-19. I do, however, want to take this opportunity to extend my sincere condolences to the families and friends of those who have lost loved ones in the past week. It is a sad fact that there are still too many greatly impacted by this virus. Yesterday marked a very significant milestone in COVID-19 as we marked a day of reflection, 1 year on since the first lockdown. There have been sacrifices made by many in the past year. We have all missed our family and friends. And we've all missed that, along with the freedom to go out and about to do the things that we once took for granted. And I'm sure there are also very many who missed going to work, meeting with friends and colleagues. Now, of course, some groups have been impacted more than others, and we cannot overestimate the sacrifices made by those who are clinically extremely vulnerable to the effects of this virus. Since December, those who are clinically extremely vulnerable have been advised to take additional steps to keep themselves safe, including advice not to attend the workplace. Whilst this advice was in the best interests of some of the most vulnerable in our society, it has, without a doubt, had a massive impact on them personally. And I am pleased today to announce the easing of this advice. From the 12th of April, those who are clinically extremely vulnerable can attend their workplace, provided it can be done safely. This is in response to the improving picture across Northern Ireland and will help those who are clinically extremely vulnerable re-engage with everyday life with more confidence. We can now see the current picture within Northern Ireland on the course of the epidemic in the following slides. This slide shows the 7-day rolling average of new cases. As you can see, this continues to decline, but at a reducing rate over the last week. The next slide shows the 7-day incidence per 100,000 of the population by local government districts. Although we have seen that fall in most local government districts, we have seen an increase, although the numbers of cases are relatively small, in Derry, City and Strabane. And I want to put on record my appreciation to the local council, local community and the Public Health Agency for their timely response in managing that small uptick in case numbers that we witnessed there. This slide shows that the 7-day cumulative total cases per 100,000 of the population across the common travel area continues to change. Northern Ireland has a higher incidence than England and Wales, as you can see, but a lower incidence than Ireland and Scotland. This data, which you will by now be familiar with, shows the estimated numbers of people infected across the United Kingdom, as estimated by the Office of National Statistics ongoing survey. As you can see here in Northern Ireland, in the middle of the chart, it is estimated that 0.32%, or 1 person in every 313 people, is currently infected with COVID-19. We also, all of us, need to bear in mind that up to a third of people infected with COVID-19 are asymptomatic. The next slide shows the rolling 7-day average of first positive COVID admissions into our hospitals. As we can see, this also has continued to decline. But what we do know is that the number of people who are admitted often remains stable for quite long periods, because many of these people will remain in hospital for significant lengths of time, and that can be demonstrated in the tail in the numbers of total inpatients with COVID, as we can see on this slide. And then finally, this slide shows the COVID positive inpatients in our ICUs. Again, there has been a gradual decline, but again, many of these people will require intensive care over a period of many weeks, and we have had some spikes in number of admissions in recent period. So, as you can see, we are still seeing a daily infection rate which is higher than we would like, but as Minister has said, things are improving. The short-term trajectory of the virus, as the Minister has also said, however, remains uncertain as we ease our way out of the current restrictions. As Patricia has updated and Minister has reflected, our vaccination programme is continuing at an extraordinary pace, and I want to put on record my sincere thanks to all of those involved. It was truly an honour and a privilege to get my own vaccine and to see how smoothly that operation was provided and running in the South Eastern Trust. And I want to put on record my sincere thanks to all concerned. So we can dare to look to something better. But I would just again say, please remember, vaccines don't provide perfect protection. No vaccine has ever provided 100% protection. The COVID vaccines are no different. So, as the Minister has said, this Easter, keep your contacts limited and remember we're not out of the woods just yet. If you do meet up with friends or family, keep to the restrictions and meet outside. That will certainly be my plan. In closing, I wanted to thank you, the public. Thank you for heeding the advice. Thank you for adhering to the restrictions. And thank you for supporting us and our health service this past year. We would not be in the position we are today without your support. Thank you.
Thank you, Michael. Deborah McAleese, UTV.
Yes, hello, good afternoon. I've worked out how to unmute myself this week. Minister, this is for you. Seeing that we're now seeing new waves hitting parts of Europe and they could potentially come here, does that mean is foreign travel out for the summer holidays?
Deborah, I would say very much so, because what we are looking at across all 5 nations in the conversations that we've had, the introduction of red lists, and those countries that are bringing a particular concern in regards to either inward or outward travel. We're seeing steps being taken in Westminster tomorrow in regards to actually fining anyone who wants to leave the country. It's not a direction of travel that we would be going on at this point in time in the executive. And also anyone entering Northern Ireland at this minute in time. We have no international direct flights at the moment. The executive is looking about establishing hotel quarantine, as we've already seen being established in other jurisdictions as well, so that we can support anyone who does want to transit even through another country into Northern Ireland, or should direct flight starts, that we will have that facility here as well.
And just in terms of the vaccination programme is obviously going extremely well, but Dr. Donnelly did say that we can only move as fast as supplies are available. Are there concerns over this threat from the EU blocking AstraZeneca being imported into the UK? Are you concerned that that could hit the vaccination programme here?
We've always kept a watchful eye on supplies, no matter where they're coming from. I think one of our small setbacks was that we lost that additional 5 million that was due to come from India last week as well, but it is programmed to come into next month. So it's not just about supplies coming from Europe. We're now looking at a worldwide vaccine supply programme and being part of the UK buying power, where we actually pre-bought 7 different vaccines. I think stands Northern Ireland in good stead for future supplies. We should be hopefully within the next number of weeks actually seeing Moderna, a 3rd vaccine, coming into our vaccination programme, which gives us an additional string to our bow as well, that allows that additional vaccine to be supplied into our centres, but also provides that additional capacity. You will be aware, as from next week, we'll be opening the SSE Arena for more bookings, and also going out to community pharmacy, as Patricia has said. So we wouldn't be taking those steps if we didn't have a reassurance and a confidence in supply, not just for the first vaccinations, but also for anyone who has received their first one, to make sure there's vaccine available for their second one. Mary-Louise Connolly, BBC.
Oh.
Hi, Mary-Louise.
Hi, yes, I'm here. Dr. McBride, this question is to you. If we're really to try and fight these numbers and the number of new infections, can you explain why Northern Ireland isn't providing more detailed and robust information around the number of clusters? In fact, the Public Health Agency has only really started to publish sectors for like the workplace, retail, health and social care settings, but we don't know exactly where, and knowing that information might help the public where to avoid and how to better apply the restrictions. So why can't we have more detailed information?
Thank you, Mary-Louise, for your question. And as you rightly highlight, the Public Health Agency publishes each week summaries of the clusters and outbreaks as that they've identified. We publish also, as the Minister alluded to in his opening comments, details of every single positive test by local government district, and we have seen an increase, as I mentioned in my comments, in Derry City and Strabane, and as the Minister mentioned, no cases reported in Fermanagh and Loma District Council. It's important that we continue to work with employers, with those businesses which are currently opened and have staff in premises. It's important that we continue to work with local communities and that they feel that they can share that information to inform our response to those outbreaks and us to complete the contact tracing, which is crucially important for us to break chains of infections. There is very detailed work with the Public Health Agency, with local councils, environmental health officer teams, local communities, PSNI, and in relation to any cross-border elements with An Garda Síochána, and indeed with local community groups. So what we do is we publish a very high-level summary of that, and that should allow to ensure that people are informed about those environments which are particularly increased risk. And if we are all conscious to continue to adhere to the precautions, we can reduce that risk.
But we don't get the detail that other countries have. Dr. Donnelly, moving across to you, the BBC understands that around 140 people last week or over the last 2 weeks with addresses in England were found to have logged on to the system to receive their jab. We have put this to the Department of Health. How concerned are you that people are being able to do that? 140 people with addresses in England were planning to come over to get their vaccines here. Surely that is worrying, or is it a case that you're not concerned because it's better that the more people who are vaccinated, the better?
Thank you very much for the question, Mary Louise. There are a number of people living in Northern Ireland who have UK addresses because they might be here temporarily, and they would be eligible to get vaccinated in Northern Ireland. And we know about those mostly, and the vaccination centres understand the rules around those. But for those who be trying to inappropriately access the service, they might travel as far as they like, they won't get vaccinated. When they turn up to the vaccination centres, they've got to prove their eligibility, and that won't do it if they've travelled. So it's not going to use any of our vaccine, and it's going to be a wasted journey for anyone who does it.
Okay, Tara McLaughlin, Downtown Cool.
Yes, good afternoon. I wanted to ask about the opening of the SSE Arena as the mass vaccination site on Monday. It's hugely welcome news, but when might we expect to see vaccinations being offered to the over 40s there?
Tara, as somebody who is in that group and eagerly waiting, I can assure you we will be opening to that next cohort as soon as we can. We had hoped to be doing it in conjunction when we did open the SSE Arena next month, but unfortunately that's additional supply that we were expecting has set us back a couple of weeks. So we should be hopefully to move into the next cohort within the next couple of weeks. But we will do it as quickly as vaccine supply allows us, and that's one of the reasons we are opening up the SSE Arena as a mass vaccination site, but also going out to our community pharmacy colleagues as well.
Thank you, Minister. And for Dr. McBride, and I would like to ask you about the clinically extremely vulnerable and the update that you've just given this afternoon. Can you tell me why you have scrapped the term shielding? And for those who are clinically extremely vulnerable and maybe don't feel safe to return to the workplace from the 12th of April, what protections are in place for them at the moment? Because we hear from them all the time that they don't feel safe actually as it is, and there are a number of employment tribunals underway as well.
Well, firstly, just in terms of the terminology, I think that we here in Northern Ireland at the Minister's request did a very extensive piece of work with those people who were previously referred to as shielding. And I want to again extend my thanks to the Patient Client Council who facilitated that, and the many, many thousands of clinically extremely vulnerable who contributed to that. And what we learnt from that was the very significant harm caused by using terminology such as shielding, the very significant impact that it was having on people's mental health and well-being, the sense of isolation. We've always said, and the Minister has always said, this was not about isolating people from society, but basically isolating the virus from those people. And it was quite clear that it was having a huge and very detrimental impact. So in all of this, it's remained advice. It's never been in regulation. It's guidance. It's guidance to ensure that we protect those most at risk. And the term shielding actually, I think, creates, in my view, a wrong impression of disempowering individuals rather than empowering individuals. Because, again, I've spoken to many people who've been shielding who have felt a huge sense of being isolated and disempowered. And what we're doing today is giving people further confidence that if they are assured of the safeguards that are in place in their workplace, and the workplace and many workplaces are increasingly a secure environment and are working very hard to make sure they're secure environments, then if they can't work from home, then they can return to work. And that gives them back some of the freedoms that they have not had for the last year.
Thanks, Tara. David
What
Young.
if
Sorry.
they don't feel safe in their place of work, though? Sorry, that was the final part of the question. What if they don't feel protected and they don't feel safe in their place of work?
Well, what I would encourage them to do is to engage with their employer. There is support that is available, and signposting to that support that is available on the NI Direct website. That will be continued to be updated. It will be updated in the coming days. And if there are difficulties that they're having in those negotiations or having those assurances from their employer, I would please ask them to reach out for those supports that are available to assist them in making that determination and making that decision to return to the workplace.
Okay, thanks, Tara. David Young, PA.
Afternoon, everyone. You'll obviously be aware of the current disparity in vaccination rates between Northern Ireland and the Irish Republic. I wonder, to what degree, or to any degree at all, will that influence the advice that both the Chief Medical Officer and yourself, Minister, give to the Executive in terms of the pace of the easing of relaxations in Northern Ireland, or will it impact on that?
David, I don't think it will impact on the advice that we give to the Executive in regards to the easing of relaxations. What it may influence is advice and guidance that we may give into interjurisdictional interactions as to how that could be potentially looked at in the future as well, because what we don't want to see is, I suppose, the risk of further COVID outbreaks or indeed different variants entering Northern Ireland once we progress with our vaccine programme at the rate we are currently doing.
And could I ask, do the experts in Northern Ireland retain full confidence in the AstraZeneca vaccine in light of some of the evidence emerging in regard to its efficacy in relation to the South African variant? And just one further question, if you don't mind, just an additional one. You'd mentioned, Minister, in terms of hotel quarantining, and obviously it's not really relevant at the moment considering we have no international flights, but can you give us more detail in regard to when that we might hear further plans in regard to that?
David, it's work that's been undertaken by a task and finish group within the Executive's COVID task force, so that update will be given when that work has been completed and presented to the Executive. And in regards to medical officials and professionals and their assessment of AstraZeneca, I'll ask the Chief Medical Officer to pick up on that one.
Thank you, Minister. Thank you, David, for the question. Obviously, throughout all of this, we will be guided by the expert advice of the MHRA, who approved both of these vaccines, three vaccines, having rigorously examined all of the evidence around safety and efficacy. And what's more, they continue to keep that evidence under review as more and more people are vaccinated. And similarly, the European Medicines Agency. So we will take our advice and our guidance from those who are doing that. And indeed, the MHRA are publishing advice in relation to side effects, for instance, on a weekly basis. So the public can be assured of the ongoing observation of the safety and continued efficacy of these vaccines. In terms of your question around variants, variants are just going to be a fact of life. We will see new variants arise, and they will arise most quickly where the virus is dividing most rapidly. So it is highly likely, as we see infection rates increase in parts of Europe, undoubtedly that is due to some of those new variants which are now widely circulating, but that in itself also increases the risk of other variants emerging. In terms of how effective the vaccines are and whether some of these variants escape from the vaccines. Again, what we do know at this point in time is that the vaccines that we are using may not provide full protection, and I've said that already in my comments today, but even with those variants that are in circulation, should provide protection from severe disease and death. If, however, we need to change the vaccines, the public should be reassured that that work is ongoing, and now that we have these vaccines produced, that actually can be taken forward very, very quickly in a matter of weeks to months. Whether we will require booster doses of different or tweaked vaccines in the future is still to be decided.
Jerry Moriarty, Irish Times.
Hello, Minister, Doctors. Thanks for taking the questions. Could I address this to Dr. Donnelly? You spoke about being on track to have the adult population completed in the summer. Just a couple of questions there from. Do you have a particular month in mind? What is the adult population? You were talking about over 18s. And just in the context of Moderna coming on stream, is there any prospect at that time that the Northern Ireland would be in a position to offer some of its spare capacity to the Republic? Thank you.
Jerry, I maybe pick up on the last point before Patricia comes in on the first two. Look, in regards to sharing capacity, one of the things that we would say, I've raised it with the Secretary of State and the Prime Minister, that once the UK comes into a position where it has surplus vaccines, that we should consider supporting our neighbours and friends in the Irish Republic, because we do share this island. It's important that we do that. But as Minister of Health for Northern Ireland, my priority is to vaccinate the population of Northern Ireland first and foremost. The vaccine that we receive as part of a UK assignment is not solely for us in Northern Ireland to decide where it can be distributed or loaned as well, but I know it's something that has been raised both by myself and the First and Deputy First Minister with the Secretary of State, and I know the First Minister has raised it with the Prime Minister. In regards to the adult population of Northern Ireland, it's about 1.4 million. Patricia, do you want to speak maybe about the timetable?
Yes, thank you. It is 1.4 million would be our target of 18 years and over, and we will have as many adults as we can get vaccinated completed by the summer, which would be by July. Of course, the second doses would be at least a month later, so we are on track to do that.
That's great. Thanks very much. And just a quick supplementary. I'm sure a lot of people will be disappointed, Mr. Swann, about suggesting that there won't be foreign travel this year. Is there any prospect, from perhaps, with the rollout of the vaccinations, that there could be an agreement whereby you can say that people can holiday in Northern Ireland at a specific date, say May, June or July? And when might that be possible for the island of Ireland? Do you have any idea on that?
Jerry, one of the things I've never done from this podium was preempt any announcement or any decision that was going to be taken by the executive, so I'll not do that. I do think it should be possible this year, this calendar year, when we can do it, will be for the executive to decide. And look, as we look to the potential for holidaying across this island, it will be dependent again on vaccine uptake and how we get to the assessment of where is safety travel, where either jurisdiction has travel barriers or travel advice in place as well, as we're conscious that the Republic of Ireland currently does. So it will be at the right time, at the right pace, Jerry, and that's how we've approached our response to managing COVID.